Hello, I'm Dr. Rowe. You must be Gary.
Yep.
Well, it's a pleasure to meet you. So why don't you start out by telling me a little bit about yourself?
Well, so I'm a senior in high school, midway through my fall semester. I'm the top 4-star recruit in the state for football. It's always been my dream to be a quarterback for the Ohio State University.
Well, that's just awesome. So tell me what brings you in today.
So, my jaw has been kind of hurting me. And, I think it might be just from a really bad sack I had a few weeks ago. You should have seen it, man. Like, they came at me. It was hard. I was on the ground. Coach said he saw 2 tears in my eyes, but I don't believe him. But anyways, I ended up turning the game around, threw for 400 yards, and it was a sick game we ended up winning. It was a sick game.
Wow, that is so fantastic. Well, it sounds to me like your pain is just stemming from that injury you had a few weeks ago, and it doesn't seem to be any loss of function or anything like that. So I'm going to go ahead and write you a prescription for Vicodin that should take care of your pain, and then you can actually pick it up today.
Sweet. Thanks so much, Doc. I really appreciate it.
You're welcome.
Thank you.
You're welcome.
Overprescribing pain medications to patients is prevalent in today's society. In this situation, you can see that Dr. Rowe failed to review Gary's medical history, perform a clinical examination, take radiographs to assess and diagnose the pain that he is feeling, and provide the necessary treatment before just assuming pain medication should be prescribed. When doctors do this, they're violating the ethical principles of non-maleficence, which means to do no harm, and beneficence, which means to do good. Dentists have an ethical obligation to avoid becoming an enabler for drug addiction and should refer the patient for evaluation when it is suspected. The next clip will show the more ethical way to tackle the situation. Dr. Bailey will assess to see if pain medication needs to be prescribed, and then she will provide the necessary resources for Gary's possible developing pain medication addiction.
Hi, Gary. How are you?
Great. How are you?
I'm Dr. Bailey. Very
Great
nice
to see
meeting
you.
So I heard you have some pain on your lower right side. Do you want to tell me about it?
Yeah, so whenever I eat anything that's like hot or cold or sweet, this side right down here just really starts bothering me.
I'm so sorry. So according to your medical history, it looks like you're allergic to latex.
Yeah.
Is that right? And you're not allergic to any medications?
No other allergies.
Okay, so for our game plan today, I just want to take a quick look in your mouth and we'll go from there. How does that sound?
Perfect.
All right, let's take a quick peek. You don't mind opening your mouth? Awesome. All right. Okay, you can close your mouth. It looks like you have a large discoloration down that lower right. Is that where you're experiencing some pain?
That would explain a lot. That's exactly where it's hurting.
Okay, so I would like to take an X-ray today so we can come up with a treatment plan and see what it looks like down under the tooth.
Okay.
That's okay with you?
Yeah,
All right,
absolutely.
let's do that.
All right.
Let's go. All right, Gary, so I did get the X-ray.
All right.
And here's your X-ray.
Okay.
If you can see, you actually do have a large cavity right here on your lower right side.
No.
So what I would like to recommend is to take out the cavity and we'll put a Malcolm fill in, if that's okay with you.
Yeah, but right now I just can't afford it. Is there any way that you can give me like pain meds or something to get me by?
I understand, but if we do not take care of this soon, it could get larger and you could lose that tooth.
Yeah, but I was told by like other dentists I've seen before that if I just take pain meds, then that will just solve my problem.
Okay, so I would like to prescribe you some ibuprofen. You can get it over the counter at a drugstore.
Yeah, but I want Vicodin.
Vicodin is actually very highly addictive and it's not very necessary for this situation.
Yeah, but it works. It kills my pain, and I think you should just prescribe me Vicodin. If you don't prescribe me Vicodin, then like I can report you.
Can you please excuse me for a moment?
Okay.
All right, Gary. I would like to ask you a few questions if that's okay with you.
Okay. What about?
So, have you been prescribed Vicodin in the past?
Yeah, of course.
So, why do you like Vicodin so much versus the over-the-counter? What?
Oh, I need it to feel better. I mean, it kills my pain. It just, I don't know why, but it just helps me feel better all the time.
If you don't mind, I would like to share a few resources with you. I'm a little bit concerned for you, and I would like to share this with you.